This is Case of the Week number 3. My name is Suzanne Johnson and I'm a gynaecologist from Southampton. The patient was 40 years old and complained of intermenstrual bleeding. She had no pain, was not sexually active and had not had any previous surgery. These two views are of the uterus. The image on the left is a longitudinal view of a retroverted uterus. So the fundus of the uterus is here. This is the posterior wall, cervical edge and anterior wall. This is a transverse view of the retroverted uterus with the right side here and the left side here. In both images you can see similar views of a brightly echogenic lesion with some posterior shadowing. What's the diagnosis? Could it be a fibroid, endometrial polyp, retained products of conception, a coil, or adenomyosis? You can see that there's something in the endometrial cavity. The endometrial cavity runs along in this direction, this being the endometrial fundus. It's brightly echogenic with shadowing behind and similar views in both the longitudinal and transverse planes. It is possible to look in another plane on 3D ultrasound. This is the rendered view of 3D ultrasound of the uterus. Here is the fundus, there are the sides of the uterus, and this is the cervical edge. And you can clearly see a circular echogenic lesion in the endometrial cavity. It's a coil, it's a circular coil. It's a very unusual appearance, and it just goes to show how 3D ultrasound can be very useful. Thank you.